Welcome to Thinking Green. I'm Rana, and you probably could not have missed that today is Giving Tuesday because almost every worthy nonprofit organization, like in the country, is reaching out to potential donors today. And in that spirit, Thinking Green also, after election time, has also traditionally focused a lot on local nonprofit organizations until the end of the year at least. So today's very timely guest is Cathy Zall, who has been here before. Welcome, Cathy.
Thank you.
And she's the executive director of the New London Homeless Hospitality Center. And there is a lot to say about the center and about homelessness in general. And we just had some really cold weather, so I think it is a particularly timely period to talk about it. So welcome, Cathy.
Thank you.
I guess we can talk about like the news later, but maybe you can start out talking about the background of New London Homeless Hospitality Center and how it got started. And of course now, we just had a really cold snap a few days ago and got a lot of people, I think, thinking about what it would be like to be outside. So maybe tell us about its origins.
Well, just the short history is probably now about 12 years ago at least. The City of New London had for a number of years run a winter shelter. Would find a building that was not being used and stand up a shelter for the winter time. And then there was this whole move to eliminate the Department of Social Services, which you might remember. And
which did happen.
It did happen. And when it happened, there was no one left to run this winter emergency shelter. And so it really left a huge gap, and there was just sort of nobody stepping in. And then very tragically, several people died outside. There was no winter shelter, several people died outside. Very unseemly did they die on the Waterford side of the line or the New London side of the line. And so really a number of people, spearheaded by our friend Emma Jarrett, just said, this can't be. We are not going to live in a city that has people dying outside. And so Emmett and a number of other people really just started in the most unbelievably grassroots way, found a church hall, opened up the doors, volunteers, and threw down some mats on the floor, and we've kind of gone from there. But that was the impetus of it. It was just a bunch of people in New London who felt from conscience that they could not be in a city that was not providing for people in the winter.
And for a long time, it did remain just as a seasonal shelter.
It did.
Right?
It did. It
November
was,
through April.
But I think one of the things, and if you think about it, I think this makes sense, that certainly it's incredibly dangerous and to be outside when it's cold. But all year round, to be outside is not good. It's not safe. It's not healthy. And so we very quickly realized that winter was critical, but it wasn't enough. And so we did eventually go to be a full year-round shelter.
And it took quite a while to find a permanent home, though.
It did, and we tried a number of places, and the opposition halted us, but eventually we did. And so now we're over near the old mill, almost right under the Gold Star Bridge, and what used to be the Polish National Catholic Church.
Now, how long have you been in that location?
I think about 3 or 4 years.
Now, I guess, at what point did you get involved in this whole thing?
Very early on. I was a pastor in the church in Old Lyme, and I had heard of St. Francis House and Emmett, and just wanted to be involved. I loved the energy of their sort of radical Christianity. I thought was just great, and so much of this is all very lukewarm, and I'm into the passionate faith-based stuff. And, Emmett just had that way, and you knew him too, of just pulling you in. And it was just like, well, of course you're going to do this. It wasn't even like, So I don't know. I mean, it just was, Emmett said, okay, I have a finance background. He said, you know money, so you're going to be our money person. You're going to keep the books. And I said, okay,
And the rest is history.
And just went from there.
So I guess maybe you can talk a little bit about what facilities you have. I mean, you took over the former Polish church and
Yes.
that property.
Yes.
But let us know, like, what's there, and I know you have some other properties as well around the city.
Yeah, so what was great for us was first to have a permanent home, and we were very grateful. All Souls Unitarian Universalist congregation hosted our daytime hospitality center for many years, and St. James Episcopal Church our nighttime. And, we were so grateful for that. But it was just great to finally, because we had promised that we would try to find something. So we finally found the Polish National Catholic Church, and were able, with some private donations and some state funding, Andrea Stillman helped us with the bonding on that. You remember Andrea?
Oh, yeah.
Yeah. And so now we were able to design the facility to better meet our needs, bathrooms, showers, laundry, and space for people to sleep. So it's a kind of a weird site. It's close enough to downtown that people can walk there, but it has a very nice feel. There's a lot of planting, a lot of trees, a lot of greenery, and so it's accessible, but I find it very relaxing, most of the time.
Yeah.
And I really am very happy at that site. I think it's a really great spot for us. And we now share the International Family Worship Center, which now owns that church there. We've worked together well. We share their parking lot, and we're grateful for that too. And so it's really worked out very well.
So you provide. You had mentioned that when you started, the daytime and the overnight facilities were separate because they were sort of both in borrowed space.
Yes, that's right.
And so you do it all in your one site now.
That's right.
So what kind of services do you have on site?
Well, at night it's pretty straightforward, right? It's a place for people to sleep, and that's people get. During the daytime, though, it's really, really important. I mean, if you think about it, if you're homeless, you're not just homeless at night, you're homeless during the day. So we have everything from, it's a place when it's raining or it's cold or it's hot, a place of refuge. And just a place to be. People would describe to me how before we opened, they would literally just walk because they would stay at the train station for a little while. And again, I understand this, the train, where's your ticket? You don't have a ticket, move on. Go and so people were just walking around all day, rain, shine, cold, hot. And so now with the hospitality center, people have a place they can sit down. Doesn't seem like much. Have a cup of coffee, use our bathrooms, take a shower, do your laundry, and use the telephone, stuff like that. But once we have people sitting there,
Oh, be my guest.
Once we have people sitting there, we can also connect and we get to know people. And we have what we call our help center, which I really like too, which is, how can we help? Oh, I've lost everything. I need $15 to get a new birth certificate. We'll help you with that. How do I replace my food stamp card? How do I do whatever? We have volunteers that help people apply for jobs. So it's a very, very busy place. And we'll get to it in a minute with our addition, but like this morning when I went in, you could hardly walk. There were so many people packed into our space because it's cold and it's winter. And first of all, that's not hospitality that we'd like, and second, it's not safe. We have a lot of people who mentally suffering from mental illness. We have a lot of people who are traumatized. We have a lot, and so we sort of pack all that into a small space is not good. So we're definitely known. People definitely know how to find us, and we have a lot of people almost every day.
Now, can we talk about what's going to be in the newspaper tomorrow?
Yes, sure.
This was not planned to have this show on tonight, but earlier today, there was news that the Homeless Hospitality had received a grant, I guess, to increase your services, correct?
Well, not exactly. It's first of all, we're not making the shelter any bigger. One of the things that we're very committed to is that shelter should be short-term and temporary, and our whole focus is housing. So there's no additional beds here. The two things that we're doing is, the first one is that we have a part of the shelter that's called Respite. And Respite is for people who are homeless but also experiencing serious health challenges. Because one of the things that we recognized is our regular shelter, for example, closes at 8:30 in the morning. But if you've just had surgery, or if you are just out of inpatient mental health, you might need to rest. You might need a little quieter setting. So we have a respite section that is, we get assistance from L&M Hospital, from Yale New Haven Health to fund. But right now it's just in a big open room. So we have a little partition, but it's just a big open room. And so one part of the addition is going to be a few sort of quieter rooms. You, like in our space now, you can't turn the lights on and off. You can't, we have people, it's just like right on top of each other. And we think with this better space, we have a lot of people suffering from trauma and PTSD and other things. And just getting people even to come into the shelter and recuperate. So we think that having this little more private space is really going to help. And then the second floor of the addition is a bigger help center. Right now, you can't even get in there. And this way we'll have more space for people to get their mail, for volunteers to help people, and just have a little more room so we're not quite so on top of each other.
Now, you mentioned the respite center. How many of the people do you see have physical or mental health issues that they're suffering from?
Well, a lot have physical and mental health issues. Respite, though, is for people with acute issues. So, for example, if you think about like minor surgery, like a hernia or like other things like that, you know, the things where if we had those, we would go home and we would stay home for a couple days.
Right, and stay in bed.
And stay in bed and rest and be close to a bathroom, etc. But surprisingly, we also have a number of people in respite who are coming out of inpatient psychiatric, and you can get released from inpatient psychiatric, and I understand that you don't need that intensity of care, but you're still unstable on your medications. You're still not, you're still disoriented. So we have a number of people who will have in respite. We've also had, sadly, a number of older people who are suffering from onset of dementia and really cannot navigate the ups and downs of a shelter with a lot of people. We have them in respite, people with broken bones. We had a gentleman who was camping in a tent and his propane heater, fell over and he got burns over
Ooh.
A big part of his body. He was in respite. We get people get the flu, people, 100 different people a year stay in respite. So out of the 500 people that we see every year, about 100 of them come through respite.
And most of us don't really think about that. If we get sick, if we get strep throat and we have to be on antibiotics, or we have an accident or something, we can come home and have a supportive environment thanks to our family members.
Right. That's right.
And people who don't have that home don't have that backup.
Right, and so obviously there's the humanitarian and the moral issue, but it's also, as it turns out, a financial issue, because if the hospital will get you to the point where you no longer need to be in the hospital, but then your discharge is to the street, or your discharge is to a place where you can't follow your discharge instructions, or you can't rest, what happens?
You end up in the ER 24 hours later.
Right. Exactly right. And several $1,000s ambulance ride, several $1,000s emergency room visit, not to mention all the heartache and suffering that goes along with it. So I'm very, grateful. I think the hospital saw early on that this could be a partnership that could work for them as well, because they don't want readmissions either. So I think it's really just been terrific. And then the other thing, and we don't have time for this, but the healthcare system is so fragmented. So the other thing we do is when somebody comes into respite, you're homeless, you have no IDs, you have no phone, you have no, how are you going to get to your follow-up appointment? How are you going to pick up your prescriptions? How are you going to, we help with all of that. And so it's a really, I feel like a healthcare service. We're not a healthcare institution. We're just ordinary people. But like your son or your daughter or your husband or somebody would do for you, we're essentially doing for the people who are in respite.
And, I did write in my notes something about how our fragmented healthcare system just exacerbates everything. A couple years ago, we visit the West Coast every year, but a couple years ago, we visited Vancouver, British Columbia, and then we were in Portland, Oregon later on. And both cities have a lot of homeless people. But, you could tell the difference because Canada has a healthcare system and Portland, and the US really doesn't. And it seemed as though many more of the people you saw on the streets in Portland were suffering. They were in pain, whether it was physical or mental illness, but it was really disquieting to see people who obviously had unaddressed health issues after being in, and it was summertime, the weather was not bad for camping out, if that was your choice, but you could just see the difference in well-being just because you knew that this group did at least have access to health care, even if they didn't have a consistent roof over their head.
Right, and one of the things, and I really give Jeannie Milstein, who the social service director of New London, a lot of credit for this. We have what we call a community care team, and she gets information about people who are picked up by ambulance multiple times, and we sit down and we think, how could we help? What could break this cycle of being transported over and over to the emergency room? And it's really the numbers, we can solve these problems. They are not insoluble problems. It just takes effort and coordination and, some resources, but it shouldn't be. People should not be out on the street like that.
No. Well, there are a lot of things that make me kind of crazy, and I think you walk around New London, I've gone knocking on doors. There are a lot of empty buildings in New London, and that we have buildings that lack, people, residents, and then we have residents that lack a permanent place to live. It just seems like we're not using our resources very well.
Well, that's the problem, though, at the heart of it, and for many people experiencing homelessness, lack of income. And so if you don't have any income, it's going to be hard for you to sustain an apartment. And in Connecticut, there's no public assistance for single adults. So if you are a single adult and you can't find work and you can't qualify for SSI, which is very hard, you are literally destitute. And so, finding a source of income is probably key for people to be able to afford to pay even some kind of modest rent.
Right. So we end up with emergency situations because we have some systemic problems.
Yes, that's right.
So in addition to your facilities at, on State Pier Road,
yep.
You have some houses around town.
We do.
Now, how do they function, and how does that dovetail with the rest of it?
Well, a bit along the lines of what you were pointing out, which is that the answer to homelessness is not shelter but housing. And we just had a couple different opportunities that came our way. One of the buildings was owned by a person who worked for the city of New London for a long, long time and passed away, and the executor of his estate felt that what he would want would be to see that building be serving other people who needed it. So they were able to sell it to us at a very reduced rate, and we applied for tax credit to rehab it. And a number of our buildings are just along those lines, just an opportunity. We have one building that the First Congregational Church in Old Lyme paid for half of it, and it's focused on veterans who were homeless. So we're not, big real estate developers, but if the opportunity comes and there's a property that we think we can do something with, and then it's just very deeply affordable housing. It's just regular housing, just cheap, inexpensive. Value.
Yeah.
Sorry, it's not cheap.
Well, a lot of
Value.
rental, I've been involved, with this, the new community land trust effort. And when we've looked at, the community assessment, rental costs is very high.
Yep.
And
Well, it's high compared to some people's income. We're better off than a lot of parts
Sure.
of Connecticut. And we work very closely with Equity Trust, who you probably know.
Sure.
So Equity Trust has financed most of our properties.
One of the things we noted, and I noted, when we've lived in our house for quite a while, for 25 years, but you can still buy houses in New London that don't need a ton of work for $100,000 or $125,000. And a person's mortgage is probably not any more than, renting a house. So renters sometimes find themselves in a bad way. But
yeah, it's hard though, because you have to qualify for a mortgage, and a lot of the people that we're serving have horrible credit, from
And that
years
is-
of being very, very poor. So for some people, that's a great avenue.
it isn't for everyone, but the housing you have does allow people to have a consistent roof over their head.
Oh yeah, definitely.
Now, maybe it would be a good idea to talk a little bit about the kinds of things that bring people to homelessness, because I imagine there are some recurring themes, but there's a lot of difference among people.
Yeah. Well, I think one of the things that really just becomes clearer and clearer to me, if you've met one homeless person, you've met one person experiencing homelessness. Okay, so there's so many different paths, but just to sort of group it together, I mean, definitely substance use disorders are huge. Okay, so people that are struggling with a substance use disorder and that leads to loss of job, leads to other things, can lead to homelessness. So that's a factor in many of the people we're serving.
Are many of those people ultimately dually diagnosed?
Yeah, I was going to get to the second is mental health, and there's a lot of very good things in our mental health system, but there's a lot of people falling through the cracks. Some of it is people's own inability, given how complicated and you're suffering from a mental illness and you're depressed, and somebody says to you, "We'll come back in 3.5 weeks and at 9 o'clock," and you're like, it's just not going to happen. So mental health, but I would say the primary cause of homelessness is poverty, right? And I think if any of us, and you probably have seen these statistics, that nationally across the whole country, there's like almost 50% of people could not come up with $400 tonight if they needed it for an emergency. Okay, so think about
That is frightening.
It is. Very, very poor people, it doesn't take much. I mean, the stories are just incredible. It's like maybe you were with a significant other and that relationship broke down and you couldn't stay there anymore. Maybe your car broke down and so you lost your job. Hours that employers will go up and down in hours like so easily. You get a health problem. So the way I look at it is that there's a whole lot of people who are very, very poor, and most of them manage to stay above the line of becoming homeless. But then bad luck really can throw some people over that line and into homelessness.
Or one emergency,
That's exactly right.
one illness away, one accident away, one.
That's exactly right. And so, for me, what is just so key about the work that we do is that I don't want like that one piece of bad luck to throw you down a drain, because homelessness can become like a funnel, a downwards pull. And so I think a lot of what we're trying to do is to just intervene, usually in very simple ways, and help people get back on track. Their own effort. We don't do it. I'm not a caseworker, right? I mean, I just think people just need a little bit of help. And then we have people coming out of prison, okay? So every week, a couple people from New London get out of prison, show up at our doorstep with their prison clothes on, and nothing.
So they're really just released, like shown the door, and that's the end.
There's a variety of reasons why that happens. But again, I think as a society, we need places like the Homeless Hospitality Center, because I'm not saying everybody can do this and everybody's going to open up their house and, do this,
Right.
but we need a place where somebody who's really like at that point can get some small and practical help. And luckily we have a couple very, very generous private donors that give us the money that we use to then, help in these little, relatively small things. Another example, like we have people that get jobs, but you can't start work if you don't have a black pair of pants. All right, so you haven't got your paycheck yet. You could get this job if you could get the boots or you could get the pants. Well, buy the pants.
Yeah.
Get them for people. It's just it drives me nuts that this isn't like obvious that this is something we should be doing for people.
And for many of us, it is a small investment to make to ensure that this person, these people, aren't stuck for a lifetime.
Right. I think it's hard to imagine. I know I can't even imagine what it would be like to be absolutely without any resources. It's like mind-boggling, but that's the situation that a number of our neighbors find themselves. So it's so funny, like people come, and they're like, "Whoa, you really do things for people here," and I'm like, "Yeah, that's the point, to do things for people and help people."
Yeah, and I think there have been some states that have tried to just house the homeless and have found that in the long run it saves money.
Yep.
It's really a cost-effective way to do it.
Right.
Now, I did look on your website and I found some stats from a couple years ago.
Sure.
And the more recent ones from 2017 and 18, that like half or slightly more than half of the people who enter your doors are served for less than 30 days.
Yes.
So these are just people who had one emergency, or?
Well, it's just what I'm sort of describing, which is that people are incredibly resilient. And I think, a lot of times people have this stereotype, homeless, not working, not trying. That's not true. I mean, I'm not saying there's rich people that don't try and don't work, and there's poor people that don't try and don't work. But, most people are just so determined to get out of homelessness. So sometimes people reconnect with family. We do a fair amount of mediation. A lot of young people that think, I don't like mom's rules, but we can sometimes work that out. People get jobs even if they've lost them. So people figure stuff out.
And so how long is the average stay at the Homeless Hospitality Center? I know you try to get people more permanent housing.
About 40 days.
40 days. That isn't really a lot of time.
Of course not, because we are doing this thing right.
Really, it seems like it's just about enough time to pick up the pieces and to figure out what you need to do to move forward.
But that's what you want. You want people out as quickly as possible.
Now, for people who want to learn more about it, you have monthly tours of the facility.
We do have tours, and they're on our website, and just call us if you want to come, and we show people around, and a number of our guests usually participate and share their stories and their perspective, answer questions. So it's a nice little tour.
I've been on it maybe once, maybe twice. I don't know if much has changed, but I'll have to do a tour after
You
the
should.
new, especially after you do
We
your
open our new thing?
your
Yes.
new expansion.
Yep.
Now, you mentioned veterans. Now, how many of the people that come through the homeless hospitality programs are vets?
Well, it used to be around 10% of the people were veterans. That number's gone down a lot, mainly because of the investment that the Veterans Administration has made. We have a transitional housing that's only for vets. There's a Columbus House is co-located with us for other kinds of services for vets. And so the Veterans Administration has really gone above and beyond, not above and beyond, they've done what they should do for people who've served. And so if we had the resources that the Veterans Administration has invested for everybody, we'd be a lot further along. So there's probably still 5%, of the people that are experiencing homelessness might be vets, but it's gone way down.
Now, is it fairly recent that the VA has really taken hold of
They've
this?
been doing it for, I'd say, 3 or 4 years, but it's matured, and I think they've gotten better. And the other thing I have to say about the VA, in addition to investing, they're very smart about it. They have some of the best researchers thinking about this, and they change their strategy as new data becomes available. So they're really, really doing a great job.
So it sounds like even if veterans come to a homeless hospitality center, there are more resources that you can tap into immediately.
Right, and that's why it's always confusing to say ending homelessness, because there'll always be new people who are becoming homeless. Now, what we mean by ending homelessness is that if somebody becomes homeless, within a short period of time, they're linked to the resources they need and assisted to get back into permanent housing.
Now, you mentioned you're not a health provider, but a lot of your focus right now is a need for respite care. So you must have partnerships to work on this.
Sure.
So who does the medical stuff and the counseling?
Well, we don't actually do medical stuff in respite. We're just really, as I said, the best analogy is what a spouse, a friend, a child would do for you if you were at home. But we have partnerships. So the visiting nurses of Southeastern Connecticut has a nurse, wellness nurse, who's there 20 hours a week. And so she can assist people with organizing their medications and linking to services. And then the community health center is there twice a week with their APRN, who's like a primary care physician.
Yeah.
Again, just like a super person. I mean, just really loves connecting with people experiencing homelessness, patient, flexible, and there's no appointment. You just sign up. You don't have to be in respite. Anybody in the shelter, and they do terrific work, and a lot of people get connected to healthcare through them.
Wow. Well, I'm thinking though, there was something I was thinking, but it's gone. I'll think about something else. Okay, now I wanted to mention Homeward Bound Treasures because partly because it is getting to that sort of shopping time of year. And, one of the points we have of having these programs is that we want people to be spending money on things that aren't just adding to the accumulation of junk.
That's right. Keep it moving
on the planet. So talk a little bit about this, start of Homeward Bound Treasures and what it does.
Homeward Bound Treasures started actually when a local hotel, the Marriott in Mystic, was renovating, and they had a whole lot of stuff to get rid of, and we thought, well, why don't we start a store? It sounds so harebrained, doesn't it?
But that was probably about 10 years ago, right?
So John Russell, who's obviously well known in New London, really kind of got this started, and just got a truck and went to the Marriott and picked it up, and we threw the stuff in a shed, and then we got a store. So it's really come a long way since then. So we had a very limited hotel-y kind of inventory when we started. But now, people from all over the region, we have a truck, and so people can call, and donate their nice things. It's not, we don't take ripped stuff and stained stuff. This is all really, really nice furniture, housewares. It's not clothing, lamps, sofas, chairs, tables. I mean, I don't buy much myself, but every time I go in there, I think, wow, those are some really nice pieces.
Yeah, you and I think we're both in more like downsizing our
Yes,
possessions
that's right.
mode.
I'm more giving it to Homeward Bound than buying it from.
Well, and when you find apartments for people outside, I'm guessing that they need stuff too. Does that go through Homeward Bound, or is that something
It doesn't
totally
go through Homeward Bound. It's
separate?
totally separate, and we're still struggling to figure it out. We have a little storage garage at St. Mary's, but keeping it organized is really a nightmare. But Homeward Bound, we're trying to make money to help support the work of the Homeless Hospitality Center. So we can't just give away stuff at Homeward Bound. But if we do, to the extent we can, and like we get donations from Connecticut College, for example, all their mattresses, when they replace them, they donate them. So we try to keep that moving along.
Now, I know when Homeward Bound started, one of the ideas was to employ formerly homeless people.
We do that still, yeah. It's not we don't have a very big payroll because we're not a very big operation. So we only have maybe 3 employees, but a number of them have experienced homelessness, and people that have started at Homeward Bound have gone on to all other kinds of work. So it's given a start for some people.
So Connecticut is known to be kind of a wealthy state, but we also have maybe the greatest disparity
yeah.
in the country, perhaps. Do you see that getting better or worse, or just from your
I think it's getting worse. I mean, I think the statistics show that.
I saw that looking at the number of people who have come for your services over the last few years, it seems like a little bit of a rise.
A little bit, yeah. I mean, again, one of the things I think what we want to do is we want to, keep getting better and better and helping people stay housed once they're housed. But yeah, I mean, and so if we see 500 people, we'll do initial interviews with well over 1,000 people a year in just this region, just, New London and, London County. So, and I think, unfortunately, I don't see poverty going away. And so I think we're going to be battling with homelessness for a while. I think I can ride out the rest of my working life doing this.
Oh my gosh. It is unfortunate, but maybe there will be a solution on the horizon.
It is definitely unfortunate, but I can't tell you how much I am encouraged by the fact that it's not brain surgery to do something about it. I mean, it does take resources. I will never say that it doesn't, but we know how to do this work. And so every day, I sometimes I joke with people. I walk around New London and all over, oh, Miss Cathy, because they're working in a store or they're just driving along, and they're housed, and it works. It doesn't work for everybody, but for a lot of people with the right help, they get out of homelessness. And so everybody's so like mopey and down about all things government, but it's not true. People are helped, people's lives get better. And so I'm encouraged by that.
Now, we're hearing a lot now about, trying to grow more regionalism in general, to try to make government in Connecticut a little more efficient than having each of the 169 towns do things in isolation. Has there been support regionally for your program?
Yeah, again, we would love to be more. The most supportive towns in the region is Groton, which helps us quite a bit. But most of the towns in our regions make a small contribution, and everybody's stretched, so I get that. But it's really the only way to go. It doesn't make sense for all these different towns, each to have their own homeless
No,
shelter.
it wouldn't.
It's difficult work, and you got to know what you're doing, and it just wouldn't make sense. So I think the regionalization makes perfect sense. And again, I think it's also, for New London, I think the mayor is very right that there needs to be some more equitable way that cities that have a tremendous amount of not-for-profit
Right.
and tax-exempt organizations are supporting the needs of their surrounding neighbors without getting some kind of compensation for the tax revenues
Sure.
that are lost. So it's a complicated issue.
Yeah, well, I don't think you'd find anyone in New London who would be opposed to the state making good on its promises of payment in lieu of taxes
Yes.
for any of the services
right.
in our cities that provide service to the community at large. And I'm not talking just about New London, but I'm sure all the urban areas in the state are in a similar situation. Now, I guess now's the point where people are convinced. How can people get involved? How can people be more supportive of your program?
Well, I mean, we have I think, a pretty comprehensive website, nlhhc.org, and on there, if people would like to donate, there's information there about donations. Another thing I would say, we have a lot of volunteers, and I understand not everybody has the time to volunteer, but I think a lot of people have really gotten a lot out of coming once a week and helping at night or helping in the help center. And it's just a perspective on our neighbors who are in different circumstances than us. And so we need money for sure, but volunteers are really important too. And then there's a number of suggestions there on the website, like, Girl Scout troops or youth groups or, all kinds of organizations. Sometimes we'll do a drive. I think some nurses in the anesthesiology at L&M just sent us a whole bunch of stuff. There's a wonderful lady that does sock drives at her bank and brings them in. And so, those kind of things help too.
And I did go onto the website, and there were quite a lot of suggestions. One of them was, which I hadn't anticipated, was invite us to speak to your group.
Yep.
So do you go out into the community?
We do.
So where do you go, to schools or to?
Well, actually, a lot of schools recently. It was, we're right near the magnet school downtown, and so we're there often, and sometimes the young people just walk over from the school and they'll help us like refurbish our garden. We talk at Rotary, churches, faith communities, all over.
Now, I noticed also on your website, this is off the topic of donation right now, but I had to mention Carf Accreditation. What does that mean?
Oh, my word, yes.
I don't even know what the acronym is.
I don't know what it stands for either.
Okay.
But basically, as you might know, like hospitals are accredited by something
Sure.
called JCO. So organizations like us can be accredited by this national organization called Carf. Very, very hard to get, I must say. So in our region, there's only a few that are accredited. And basically, the reason we did it was eventually I'm hoping to bill Medicaid for some of what we do. But also, it's just a very high standard of fiscal accountability and planning and personnel practices and the quality of the work that you do in helping people. So it's a very rigorous process, I was very, very happy to get
How long a
through.
process did it turn out to be?
It took a long time. It took a long time. They have a book of standards that's like about this thick.
I've gone through early childhood accreditation
this is-
stuff, and it
yeah.
probably is similar because it takes on every aspect of it.
Everything. Your signs, like you have to have your signs a certain way. I mean, but again, I have to say, if I look at any one of them, I see why. I see why that, if you are trying to do a quality program, this is what you would do. So I have no, it was just a little overwhelming because there were so many of them. But, you know, we made it, and actually we have to get accredited again come August, so I'm getting ready for that.
I'm guessing renewal is not as hard
I hope
as
not.
the
hope
first
not.
time. So when is your next tour?
I
Do you
don't know,
know?
it's on the website. I would
Yeah.
assume it's sometime in December.
Because they are really worthwhile. I noticed that your tours are led or assisted with residents
Oh, yeah.
there.
Oh, they're the best.
And the stories are pretty compelling. So maybe just, we have about, I don't know, 6 or 7 minutes, 5 minutes, I'm told. Maybe tell a little bit about some of the people who are living there so that, you know, people can get an idea that they're really just people.
Yeah, I'm trying to think if I'm close enough to it. Well, I can think of a young person who was really in a difficult situation at home, and you know couldn't take it, and was living actually in the woods for quite a long time, not right in New London, sometimes somewhere outside of New London, and came out of the woods to go to a convenience store, and the police, not in a punitive way, but in a helpful way, connected with him and said, young man, he was like, hadn't eaten in a long time, let me take you over to the Homeless Hospitality Center. And we now partner with a program for youth, a shelter for youth, and NOANC Community Support Services runs. Got him into that youth shelter, and you know, he's gone on from there. You know, people who, a surprising number of older people too. We have a number of people who are,
Wow.
you know, older than me. That's pretty old. And I'm trying to think. I can't think like off the top of my head of a better
Yeah.
specific.
And no, it's looking at profiles. The website, by the way,
Oh,
is
yes,
really
has several.
good.
Yep.
And you know what kind of struck me was how people could get to homelessness through so many different avenues.
Definitely.
I mean, there could be a divorce, it could be a job loss, it could be a health emergency, it could be, you know, substance abuse.
Yep.
There are so many ways that people can just go over that edge from managing barely.
Well,
to
yeah, and that's where
not.
poverty comes in. I mean, I think all of us in our lives have ups and downs, you know, that things that happen. But if you have resources, and that's not just money, that's also family and an extended network that we sometimes take for granted. But there are people who just don't have that. They don't have family, or in some cases they burn bridges from, you know, with family. And so when you don't have the financial or that social support system, you can fall really fast.
It's kind of scary how fast you can
It
fall.
is.
And
It's very scary.
what you had said, that people, half of the people in the state, in the country, if $400,
Yeah.
they
a big
couldn't come
study.
up with in 24 hours.
Yep.
That really is incredibly frightening, because I have been pretty impoverished, but I don't think I've ever been in that situation where my life would fall apart if I had to find $400.
Right.
So we talked about volunteering, tour, donated materials. I noticed on the website people can sign up for a newsletter or for the
Yes,
e-blast.
we're out there on social media. Yep.
Oh, so you have a Facebook presence?
Of course.
Well, I went
We
to
have
the web.
Instagram. I don't even know how to use Instagram, but we have Instagram.
I have no idea about that either. I actually went to the website because NLHCC.
I know how to use websites. I know that.
homehc.org, because it's easy to remember, and
Right.
there really is a tremendous amount of information. And in the last minute or two, if people need help, how do they get it?
Yeah. Connecticut, again, has a fabulous system across the whole state called 211. And 211 is the information referral for a lot of different things, but one of the things that they do is they take calls related to homelessness. And so if somebody is having a housing crisis and calls 211, 211 will first try to help if they can, utility assistance, things like that. And if not, they'll schedule the person to the closest, intake site. So that is such a huge improvement. It used to be if you were homeless, you call one shelter, then you call another shelter. Oh, call back tomorrow. Call back. So your minutes
So now
were up.
it's all coordinated.
It's all coordinated. Coordinated access, it's called. And we also do allow people who have, let's say if your appointment is tomorrow, we'll let you come into the shelter tonight, because again, I don't want people to be, outside in this kind of weather.
We don't want them to freeze waiting for an
We do
appointment.
not.
And right now, that's a real fear.
That's right. That's right.
Well, thank you for coming on again, Cathy.
Always
and-
a pleasure.
And people will be able to read more about what your plans are in tomorrow's newspaper.
Yeah.
I think I saw the article come online at around 5 o'clock this
Oh, good.
evening.
Well, thank you.
So, and good luck getting through this year and with all your new plans.
Great. Well, thank you very much.
And next week we will continue. I'm not exactly sure with what organization, but from now till the end of the year, we're going to be profiling local nonprofits. So thanks again, and we'll see you next week.